Welcome, listeners. I am so blessed to have you here today. And I want you to know I have the most amazing guest. I can't even believe the people that I get to have on. This lady was commissioned by Maria Shriver to write a book that's coming out today called The New Rules of Women's Health. Her name is Meghan Rabbitt. She's been a journalist for over 20 years. She's written in Women's Health and Oprah Daily. And we are going to talk today about perimenopause. We're going to talk about the difference between perimenopause and menopause and what are the actual symptoms of menopause. And then um, we're going to talk a little bit about what health conditions become more common after menopause. We're going to get into that controversial hormone therapy, but I feel so blessed to have Meghan with me today. You're going to love this conversation and go get her book, The New Rules of Women's Health. Like I said, it's just coming out today, hot off the press. So just stay tuned. I'm so thrilled to be talking about menopause with Meghan. Here we are with the one and only Meghan Rabbitt. Meghan, I am so thankful to have you here today. I kind of feel like you're a big deal. You've done some big things, and I already introduced you. You've been writing for a long time. You've been writing for some kind of amazing people, and you've got that book coming out today. I mean, that's exciting. The New Rules of Women's Health. And I don't even know what could be more worthwhile on this podcast than to talk about this subject. And, today we're going to get into talking about menopause and perimenopause and all those good things. But Meghan, before we get started, my listeners always love to get to know the guests a little bit better. And, what led you to do this work? What led you to be a writer? And what led you to write on women's health?
Yeah, looking back, it all kind of makes sense now that I have a bird's eye view of life, really. I always wanted to be a doctor when I was a little kid.
Oh,
I thought I was going to be a doctor and I was a little feminist. I'm 46 now and was like, this is what girls can do anything boys can do and better. And then I hit biology and chemistry and was like, I don't know that med school is my path. And I always loved writing and yeah, and writing was always a way that I processed things,
mhm.
as a little kiddo, I would go to my journal and that's how I really tried to make sense of my world. And so it's not so surprising that I ended up in a journalism class and fell in love with journalism in particular, nonfiction writing, and then gravitated towards writing about health. So I started my career in magazines in New York City and always found my way onto the health beat. I started at Parenting Magazine back when I
Mhm,
was a 20 nothing year old baby writing about babies and health topics new moms needed to know and new
mhm.
parents. And yeah, and then I ended up freelancing for a number of different magazines. And one of the articles I wrote a few years ago is on women and Alzheimer's disease. And it was really taking a look at the differences between women's brains and men's brains and what we know and don't know about why women disproportionately suffer from Alzheimer's. And in addition to interviewing neuroscientists and many experts in the space, I also had the privilege of interviewing Maria Shriver, who is the founder of the Women's Alzheimer's Movement, which is now part of the Cleveland Clinic. And I did a profile on her, really found out why she's so passionate about this topic and what we need to know. And after the piece came out, Maria called me. And
Oh,
I know that
that's
so
so cool.
my heart stopped and I sort of went to the dark place first. I said, "Oh no,
Okay.
did I mess something up? Did fact checking not catch something?" And she called and said she loved the piece and thought I did a really great job. And
So
and would I come work for her? So Maria has an amazing media company that produces a weekly digital news magazine called Sunday Paper, the Sunday Paper, and I'm an editor and a writer for that. And about a year into working on that newsletter, Maria said, I want you to write a women's health manifesto. We haven't had a really comprehensive book on women's health for a long time, and I want you to write it. And so here I am. I spent 3 years. I interviewed 132 of the country's leading doctors, researchers, experts, other clinicians about women's health and what we most need to know to take care of ourselves and our families and to advocate for ourselves.
Well, God bless you. I mean, I love that story. That's a good one. Because, I mean, Maria Shriver, it has to be an idol for most of us. I
Yeah.
can't even imagine. But, I mean, I love that she is looking into women's health because I think I read something that you alluded to, the fact that they kind of treat us like we're little men.
Mhm.
Like, and I'll look at it too, and I'll be like, "Okay, why is my husband, who's like twice my size, taking the same dosage as I am in this medication?" And there are so many questions. I feel like I wanna have you back on to talk about Alzheimer's because I could start digging there too. But I'm just so thankful that we're finally starting to look at women because I'm a breast cancer survivor. There are women issues, and let's start talking about them. Let's start looking at us as we're a little bit different.
Absolutely. And really this was a driving force for me with this book, A Guiding Light, in that for a long time, women's health was what we now refer to as bikini medicine. It was our breast health, our gynecologic health, our sexual health maybe. And we now realize that that's not good enough. Our
Yeah.
hearts are different, our brains are different, and we have a lot more research to do, a lot more ground to cover when it comes to really understanding the intricacies of the differences to help us really take care of women with a sex focused lens.
Yeah.
But we have made some progress. And so, what I tried to do in this book is encapsulate what we do know about what's different about us. We are not small men. We do have some understanding, and at least with that baseline understanding, when we know it as women, we can have better conversations with our doctors to try to get the
Mhm.
care we really deserve.
Amen. And I think as we move along in our conversation, I am going to want to talk a little bit about heart and cholesterol. And I think we're going to get there when we talk about the health conditions that are more common. But let's talk a little bit first about the differences between perimenopause and menopause, and how do you know which one you're in?
Yeah, I think we are collectively starting to talk about menopause a lot more now, which is fantastic, right? It's like my mother's generation, they weren't really talking about menopause. And now I'm at age 46. I can't go anywhere where women are gathered without talking about menopause. And I think this is a great thing. But I also think there are still some things we're not understanding about it. The first being perimenopause is that time leading up to your last period. And in fact, you're not technically in menopause until you've gone a year without a period. And I think
Right.
that still surprises a lot of women. We say, "Oh," another big thing that I heard from multiple doctors I interviewed for my book is that, you might think you're in menopause because you've gone a few months with no period, but you could go 10 months with no period and be 2 months away from that menopause date, and then if you bleed, the clock starts again.
Well, and it's crazy because we're all like little different beings as well. And I remember at my son's wedding, my daughter-in-law's mom was like, "Oh my gosh, I got my period. I haven't had it in over a year." So, you just kind of never really know for certain.
No, and I think, you're bringing up a beautiful point, which is that we're all really different, just like we
Mhm.
got our periods at different
Yeah.
ages. We're going to go through menopause at different ages. And it's really important to stay clued into our symptoms and to write down when our last cycle was so that we can answer that question. If a doctor says, "When was your last menstrual cycle?" and you know exactly it was 10 months ago. Or, for example, if it was 2 years ago and then you start bleeding again, that's noteworthy and something you
Right.
should call your doctor about immediately.
Right. Exactly. Exactly. And I think that I am seeing my daughters do that more where they're tracking things better.
Yeah,
I didn't. We didn't track it. I mean, I remember going to the doctor, "When was your last period?" "I don't know." I mean,
totally. And now we have all these apps that
I
make it
know.
quite easy, and I think even for the woman who's in that transition, and even postmenopausal, like, why
Yeah.
not keep a diary of your symptoms and what's going on so that when you do have that annual appointment, you can say, "Actually, I notice I'm feeling a little more blue at these times of the month or
Mhm.
whatever it is, I think, yeah, I think what I'm also hoping is that women, when they read this book or can turn to this book, they walk away feeling like they can be a health journalist in their own life, you
Oh,
know?
yes.
Because as a journalist, what I do is I did not go to medical school, but what I do know is who to call to ask and
Mhm.
what questions to ask so that I can help gather information and translate it into, from what can sound a little medical jargony into language we can all understand. But this is something we can all do,
Yeah.
is understand a little bit more about the landscape of a big hormonal transition like menopause and then say, okay, here's what I know. And now let me bring what I know to my doctor so that we can have just a better conversation about care.
Right. Well, and what I wanna add too, I think your book we're focusing on more menopause today. Your book focuses on more than that.
Yeah.
No, and you just think about, like, puberty and all the things that we have gone through. It is going to be so helpful for mothers to read it for their daughters. I mean, it's just for my granddaughters. I think it's gonna be so helpful because I feel like and I wanna start getting into this a little bit more. I feel like I don't know a lot. Like, I went through perimenopause. I had horrible, heavy periods, like, devastatingly, like, it was hard to even, at some times. Nobody did anything about it. I mean, I just remember, yeah, that's kinda how it is.
Yeah. Yeah, I think we as women tend to take care of everyone else.
Mhm.
I interviewed one doctor, a breast specialist, who said oftentimes the dog gets more vet appointments
Yeah.
than a midlife woman.
Yeah.
And we tend to just chug along. We just think, I can speak personally about this. I had very heavy periods right around the time I was turning 40 and after. And because I think we're talking about perimenopause and menopause so much, and I knew that heavy periods could be a sign that I was entering, the transition, I ignored it. I was borderline anemic.
Mm.
I was really not doing great with heavy periods, and finally, because I was reporting this book, and I just kept saying, "Uh oh, like I don't think something's right here." I brought it up with my doctor. Turned out I had a uterus full of fibroids. And so it's remarkable what, even with a baseline knowledge that I had after being a health journalist for 20 years, still I ignored my symptoms or just chalked it up to like, "Ugh, it's just a bummer. I hemorrhage once a month?"
Well, and Megan, I find that too, like, you go to the doctor and I was just always like, "Oh, I mean, I'm fine." It's kind so you never, like, make it like it's a big deal.
Yes.
And there's
Yes.
so many things that and even I had my breast surgeon on, and I had, like, a teeny tiny, it was stage 1, but I could feel it. Like, not feel it, but I felt something inside that was painful, and luckily, I got my mammogram because I don't think that I would have put it together.
Yeah. Yeah.
So take listen to that body, and like you're saying, write it down and bring it into your doctor.
Yeah, and believe yourself. Don't try
Yeah.
to talk yourself out of, "Oh, I'm probably fine." Or I think for other people, it can be like an ostrich approach where you
Mhm.
just stick your head in the sand. You're like, if I don't think about it, maybe it's not there.
Yeah.
But I think, these are our bodies. It's the one body we're gifted. And our stories about our bodies are really important. And it's important for us to believe ourselves that if
Yeah.
something we don't have to suffer through. I interviewed Dr. Vonda Wright for this book, and she said she's an orthopedic surgeon, tremendous physician, who said, I can't tell you the number of patients I have, and they're all women who brag about their pain tolerance. They wear
Mhm.
it like a badge of honor. But why? You bragging about a high pain tolerance means you're probably not getting the help and the treatment that will make you feel better, that will keep you out of
Yeah.
pain? And so, yeah, I think again, with this book, what I tried to do and hope I've done is help women understand sort of what's normal, what's not, what questions they need to be asking so that they're not overlooking some of these symptoms that they might be having or
Right.
things they feel they really want to talk about with their doctors.
So tell me I can't believe I've been through menopause. I don't even what are the symptoms? I know hot flashes. I know not sleeping great, but what else? Like
Yeah.
what? I don't even know.
That's the thing. There are some biggies that we talk about a lot, right? You're naming
Yep.
them. Hot flashes, night sweats, which is actually just a hot flash that happens in the middle of the
Right.
night, right? We've got menstrual cycle changes. So it can be common when your hormones start going wonky in that perimenopause period for cycles to get longer or heavier and then lighter, or, they get a little wonky, so to speak. um, the genitourinary syndrome of menopause, formerly known as vaginal atrophy, which thankfully got a little bit of upgrade on the marketing term there. But this is really, really common, and as women, we need to talk about our vulvas, and what's happening there, because the symptoms, the changes that can happen can lead to symptoms that are really not fun and really treatable. Um,
Mm.
and so mood disorders is another big one. I know my mom, who seemed, when I've asked her about her menopause experience, she seems to have sailed through fairly well. But she said to me, every so often I'd feel a little blue. And I think that was her way of saying, I felt a little depressed every so often. This is really
Uh-huh.
common. Um,
I didn't Megan, I don't mean to interrupt you, but I
Nope.
did not realize that that was something that happened during menopause.
Yeah.
Like, I know that I dealt with that, you know, through my cycles, and I think I too kinda had it easy through menopause. I really did do well through it, which was wonderful, but I didn't know that mood swings were a part of menopause. I thought it was that was like, you got to let go of that.
Totally, yeah, and not so much, right? Because as hormones are going up and down, it
Mhm.
kind of, like, mimics PMS in a different sort of way. And yeah, and I think, I'm in the transition at age 46, and I'm not experiencing anything sort of really big, no major hot flashes yet or things like that. But I just had my general, wellness checkup, and I said to my doctor, "Every so often, I feel a little ragey." And for no good reason, and then the next morning, I might be, like, crying for no good reason, and, like, "Oh, there's those mood things that are totally workable, but, like, let's talk about them," rather than me saying, like, "I am doing great," like, be honest
Right.
about some of those things, even if they're subtle and not really debilitating, they don't really stop life as I know it. Um, some of the other sort of ones that I don't think talk enough about is an inability to concentrate, a little bit of brain fog,
Okay.
um, itchy skin, dry, itchy skin everywhere. Because when you think about it, the same reason your vulva might feel a little drier than
Mhm.
usual, there are estrogen receptors everywhere, including on our skin. And so skin changes can happen. Hair thinning, wrinkles, weight gain, breast pain, joint pain, constipation, some dizziness, high cholesterol. We'll talk about this with heart
I really
disease.
wanna yeah, I really wanna talk about that.
Cholesterol can go up. Our sensitivity to insulin can change, which can create conditions that can lead to more likelihood of diabetes. So there are a lot of symptoms, and like over 100. And
Wow.
rather than knowing what they all can be, because, like, that feels a little, you know, uh, not realistic. Again, it points to keep a journal or
Yeah.
open up a note on your phone where you're just, typing in or writing down what you're experiencing so that you can talk to your doctor at your next checkup and say, is this part of the menopause transition?
Right.
What's going on? And you can really have a better dialogue about what you're experiencing.
And Megan, it's so interesting to talk to you because I do know like the weight gain thing is a big deal for a lot of women. And it's hard because they feel like I've been through my whole life, but you talk about there are things you can do to get metabolically fit.
Mhm.
That and it's so interesting how back in the day, I could do things differently. Like a glass of red wine wouldn't bother me. I can't drink it now. It just makes me feel like junk. Bummer, right? But not good to know. And so I think there are some things that just knowing it and knowing that we can do something about it, and it doesn't have to be that hard. I don't have to do like a 48-hour fast to become metabolically fit. I can maybe hold off that first meal. I mean, there's things like that. I want to know though, I was just talking to one of my best friends who's exactly my age. We've been friends since grade school. And she was saying, why is it that so many women have issues with their cholesterol when they are in menopause? And what is that? What is that about?
Yeah, again, I think we are trying to learn exact answers, but what we do know is that and are learning is that the female heart is different than the male heart. And estrogen and progesterone and these sex hormones that we talk about when we talk about menopause also impact how our heart functions. And so, yeah, it speaks to how much more clued in we need to
Mhm.
be when it comes to like, uh-oh, I was recently diagnosed with borderline high cholesterol and I was really resistant to taking a statin because I was like, I can do it with exercise and diet. But I interviewed a cardiologist who said, look, women in particular tend to be the most resistant to statins because we think, as I did, I can do
Yeah.
it myself without recognizing that there are just some changes happening that we can't control, which is the decline of estrogen when we hit a certain age, which is impacting how our heart is working and how we
Mhm.
lay down plaque in our arteries. And yeah, so I think it's something to be aware of. And I think particularly when it comes to heart disease, one of the biggest ahas was I interviewed a preventive cardiologist who said, unfortunately, women's awareness of the fact that heart disease is our number one killer is going down.
Well, yeah, that's interesting that you say that, and I've been so bloody focused on breast cancer because that was my thing,
Yeah,
right?
understandably so.
Yeah, and here's the thing, it's just so important to be aware because you can do so much for it. You're in such great shape if you go in and get your mammogram and find it, or if you pay attention to your cholesterol. And I've done some deeper dives where I've looked at some other things in my blood to see looked at my genetics to see, you know what I mean, and really looked at it. And I have to take a statin. I'm one of the lucky ones who gets to be on an estrogen blocker for a few more years, so yay me. So I can't do I did do some hormone therapy. I had a functional assessment doctor that helped me with that back in the day, but let's talk a little bit about that because I think that is maybe affecting a lot of this. I think that women can feel a lot better with this hormone therapy, but I don't know a lot about it, Megan, so teach me.
Yeah, so we are talking about hormone therapy in more detailed ways because we have a better understanding of it now, and I think a lot of doctors and researchers have thankfully really come online on social media to help educate us about what we got wrong. I think even just let's say 10 years ago, certainly maybe even 5 years ago, anybody in their 40s if you mentioned hormone therapy for menopause women would be like, I don't want it. It's going to cause cancer. That
Yeah.
was the understanding, and what we know now is that actually that's not necessarily true. It's not to say that everybody is a candidate for menopause hormone therapy or AKA hormone replacement therapy.
Mhm.
But I think what we thankfully know now is that we don't have to be as scared of it as we were. What we do need to know is what it's indicated for, and then let's have a conversation with our doctors to understand if we are a so there can be a lot of overblown information about hormone therapy being a panacea for everything. Whereas the research shows us not necessarily. What we really do know is that it helps protect our bone health, which is
Mhm.
crucial as we get older, right? It helps with the vasomotor symptoms of menopause, which are those hot flashes and night
Mhm.
sweats and a few other indications. And so, and I'm also grateful that we are really starting to talk about vaginal estrogen, local vaginal estrogen, which doesn't go systemically through your body.
No, and that is something that I am able to use.
Fabulous.
Even though I'm doing an estrogen blocker, I'm able to use that.
And
Yeah.
that's amazing that you have been able to have those conversations with
Mhm.
your doctors to be able to say, look, you're still a candidate, even though you are a breast
Mm.
cancer survivor.
Right.
So these conversations are great. But I would say, I resisted an IUD for years because I was just like, I don't want any hormones in my body.
Right.
And now I'm like, huh, I actually wonder, who knows, if having an IUD inserted might have prevented my uterus full of fibroids, which I was diagnosed with a few years ago. Who
Uh,
knows? But I think thankfully we are starting to realize that. Hormones are in our body and really important. And
Yes.
when women in particular go through the drastic drop of those hormones once we hit menopause, there are some supplements we can take, AKA hormone therapy,
Yeah.
to really help us ease some of those symptoms.
Well, and I think too, like I said, that's not a route that I can take. But there are, I mean, I have figured out some other things that work too. You know what I mean? Like for bone density, I've been doing some osteogenic loading through something called OsteoStrong. I actually reversed my, I mean, my bones have gotten stronger, which is amazing.
And is this through jump therapy? Like, are you jumping?
So what this is something different, which is a whole nother topic that I've had the owners of this on. It's more about weightlifting is really important. I do a lot of weightlifting. I do a lot of walking, tiny little bit of jogging. But this osteogenic loading is putting heavy loads on your bones through these 4 machines for a really short. It doesn't feel like you got to work out really, but it helps your bones rejuvenate. And I haven't taken any medication, which I do love if I can.
That's
Now,
amazing.
I know I have a daughter that's a doctor, so I, like, believe in medicine, and I love to get the natural stuff when I can too, so I
Totally.
kinda try to marry them together a little bit. But, I mean, and sometimes, like I said, I can't take estrogen, so I have to find other ways, and here's the thing, if I don't have wine, I don't get a hot flash. There are certain lotions when I put them on, and it's just being aware. I put it on and I go, "Why am I getting a hot flash today?" Oh, it's that junky lotion that I got,
Well,
that
and I so hear this. And don't you think what's so beautiful about women as we get older and as we go through this menopause transition, we start to be like, oh, I'm going to listen to that, right? I am so
yeah,
with you on the alcohol. I used to have a glass or two of wine at the end of the night with friends. It's super social, right?
yes.
Even one glass these days, I know I'm gonna pay for it. I'm gonna
Mhm.
wake up in the middle of the night with, like, my heart racing, thinking, like, "Why do I have heart palpitations at 2 o'clock in the morning?" And it's like, "Oh, and now I'm really not drinking." It's a very rare occasion that I have, like, 1. And
Same.
now that we know all we know about the
Mhm.
cancer risk that's associated with drinking, like, man, if I could write a love letter to my younger self, it would be like, "Don't drink so much," you know?
Oh, no kidding. I have
Yeah.
talked about that. I wish I would have known that, Megan, because I think back when I was raising my kids, I mean, it was like, "Have a glass of wine's good for your heart," and it never made me feel good.
I know.
I mean,
I'm
but, it
same.
was easier to get over it. Now I'm like, "Okay, I wanna get up and work out, and that's not gonna happen for me, even if I just have
Bingo.
a glass."
Yeah, bingo. I'm so with you, and I love that you're bringing up weight-bearing exercise as well, right?
Yeah.
That's another thing, like, women in my generation and older and even a little younger, like, we were sweating it out on the elliptical machine while
Oh,
all
I
the
know.
all the boys were in the weight room doing great things for their bone health, right? And so, yeah, I think, now that we know better, we do better, right?
Yeah.
And knowledge is power, and once we have this information, I think it really can inspire us to say, "Okay, I know that I'm gonna be at increased risk for certain diseases after this menopause
Yep.
transition. So now that I know it, what can I do?" Because even a lot of these
Mhm.
doctors I talk to really do say, those lifestyle habits you hear about all the time, like eating well, exercising, not drinking, they sleeping well,
I was just gonna say that, yeah.
they really do work. They
They
really do
work,
work.
and Megan, that was another thing that I always missed out on was taking care of my stress and my sleep, and it's the one thing that I still have to work on.
Same.
I mean, just, like, white knuckled it. I don't know why, like, high achiever, people pleaser, I just always felt like I had to do that. I was eating well, I was working out hard, but maybe too hard. I did this course and I started doing these really long fasts. Everyone was losing weight and I gained like 2 pounds. It's like on a 48-hour fast, I'm like, "Okay, something is not right."
Might have been stressing your body out,
No, it was
right?
probably the cortisol
Yeah.
raising, and so when I finally let go, then it dropped off, which is interesting, isn't it?
It really is, and it speaks to how we have to listen to our bodies, What works for you may not work for me, may not work for my best friend, even sleep specialists who will tell you, that whole, like, 8 hours a night ish, right? My bestie functions great on 6 hours, whereas
Right.
frankly, I feel like I'm my best when I'm at more like 9. And
Yes.
so, when it comes to these things, we have to understand that, this advice is a good benchmark, and then listen to yourself and trust
Amen.
trust yourself too. I read something recently where it's like doctors know bodies, but we know as patients, we know our bodies.
Mhm.
And so it's that blend between, of course, I want to work with a doctor or a healthcare provider who has been through years of schooling, who can help me put my symptoms into context for my age and my health, my
Mhm.
family and personal health history. But I also have to believe myself. I have to say,
Yeah.
this doesn't feel right to me. And I want you to know about this so that we can talk about this. And
Well, and care for yourself as you would care for your best friend or your child,
yeah,
because I think we miss that. And we can team up with our physicians. We can take notes, know what's going on, and care for ourselves because, like we have been saying, we are all different. We all are going to pop up with different things, and then be aware.
yeah,
Know what your cholesterol is, know what's going on. And I know I have been afraid. I have been afraid to do things. But we don't need to be, because the more knowledge you have, the more you're able to heal. And our bodies are able to heal.
yeah, yeah. I love that. And I think, when you're writing down the symptoms that you're experiencing, one of the tips that a doctor I talked to gave me, which I really have taken on board, and it's changed the way I act at every doctor's visit, is she said, we don't unfortunately have 2 hours to sit with you. And
Right.
that's what we as doctors, as good doctors, we wish we had more time, but we don't. And so write down a list of all your symptoms and what's happening, and then organize that in order of priority.
Oh, I love it.
And understand you might only be able to get through 3 of your top concerns, but at least you're talking to your doctor about what feels most important to you or what's impacting your life the most, so that then if there's other things on that list, you can say, "Okay, what's the best way to follow up on the rest of this? Can I do a telehealth visit, which you might get
Right.
faster than an in-person visit? Can I schedule another appointment?" And so I think, yeah, we have to listen to ourselves. We have to prioritize ourselves. We have to not be racing through life so fast and taking care
Yes.
of everybody else that
I
we
know.
ignore our own bodies and our own well-being.
Amen. I know. Take that time and that stillness and listen to your body, and take the time to write it down before you go into the doctor. What's
Yeah.
going on? And really sit and think about it.
Yeah.
Because I think we just blow we I have the rushing woman syndrome once in a while. I think there's a book about it.
Yep, I can relate to that, and honestly, Lisa, another reason I laid my book out the way I did is that it's a pretty big book. Like, I'll hold this up for you. It's 700 pages,
Ooh, I
and
like it. I can't wait to get it.
it's
I'm gonna pre-order it today.
Hey, thank
Yes.
you.
Yeah.
Yeah, it's a book that it's broken out into chapters that focus on various aspects of our health, so that, it's not a book that you're gonna cozy up with and read in one sitting with a cup of tea on your
Right.
favorite couch. What I'm hoping it's a book you put on your coffee table that you can turn to if you have your mammogram coming up. You might flip to the breast health section,
Yep.
the breast health chapter, and say, "Okay, or for me, I have dense breast tissue. And so after every mammogram, I usually have a follow up sonogram
Yep.
or more diagnostic, just to make sure the lumps that the
Mhm.
mammogram turns up are just lumps and not cancer." And
Mhm.
and so not only did I learn a lot while reporting that chapter, I gave it to my husband. And I said, "Brian, like, you need to read this chapter so that when I'm freaking out after I have to go for this follow-up, like, you can better support me?" And
Mhm.
I love, a friend was like, "This is totally a coffee table book." And the goal is that not only will you turn to it or give it to your daughter or your niece or your granddaughter, but also the men in your life. Don't we want our sons and our
Mhm.
husbands supporting us at every stage?
Of course we do. I just think, yes, it's so time for this book. And I'm so grateful. I'm so grateful that you've given your life to this. I'm so grateful that Maria had you write the book. And I'm just in awe of it. And I feel blessed to have had you here. today, the day that the book comes out, and Megan, I feel like I wanna have you back on to talk about Alzheimer's, if you don't mind.
Let's
Oh,
talk about it, and I can, recommend doctors who I interviewed for this book who are dedicating their life to
oh,
understanding why we as women particularly, suffer disproportionately.
yeah.
2/3 of cases of Alzheimer's disease are
Is that
women.
crazy?
2/3,
Yeah, nobody wants that. No one
Nobody
wants that.
no, and finally, we're starting to uncover why, some of the reasons why,
Okay,
and I
well,
think
we're gonna that's a teaser
let's do it.
for the next one.
I will see you back here.
Alright, Megan, thank you so much.
Thank you for having me. I absolutely love talking to you.
You take good care.
You too.